Okay, so we have our new series. Good morning. My daughter is sick. I barely slept last night. I'm also coming off of a sickness, so bear with me, please. So this is our pregnancy series. So Abby and I are doing our own little spiel about our pregnancy experience, labor, and delivery. Abby and I have wildly different experiences, and that's kind of standard across the board. Pregnancy and labor is not a one size fits all. Every single woman has her own experience, and that's kind of what we want to highlight with this series. So the biggest takeaway for, I guess, me and why I really want to share my story is I really want to share how to advocate for yourself and being your biggest advocate. So I want to go through a few things that I did to really prep for just pregnancy and labor and delivery. So my fiance and I already knew that we wanted to have a big family. So we were prepping, I want to say 2 to 3 months in advance. I was taking prenatals before we even started trying to get pregnant. So I was taking ritual prenatals. I honestly was just shopping at Whole Foods and I switched around with a couple of different prenatals. Unfortunately for me, I threw up literally every single day, my first trimester and my third trimester. And my second trimester, I can't really remember. I don't think I threw up that much because that was when my bar prep kicked in. So I also studied for the bar when I was 7 months pregnant. Don't recommend. So I took the prenatals 2 to 3 months before we started trying, just to get my body ready to hold the baby and give the baby all the nutrients that she needed. We don't need to go into that much details. It is crazy because I think I was around 3 to 4 weeks pregnant, and I was sitting on my floor doing a yoga class in my living room, and I just had a whisper in my ear being like, you need to pee on a stick, like go take a pregnancy test. So kind of whenever I get those feelings, I take it as like a sign from God. So I immediately took a test and I was pregnant, which was great because we wanted to, but it was also terrifying. Okay, so my goal was to do as much research as I could. I'm an attorney. I don't know if this is because I'm a closet nerd. I love to read. I have like over 100 books of just like nonfiction. I love to learn. And so all I did my first trimester was research. I followed a lot of labor and delivery nurses, holistic nurses, Dr. Green Mom, all the Instagram pages that I could find. My screen time was insane. It was over 18 hours a day because I would just sit on my couch and scroll through Instagram trying to figure out the best way to have the best possible pregnancy experience and the best possible delivery. So my pregnancy experience was absolutely horrible, but I had a beautiful birth and it can't all be perfect. So I don't know what I would rather take. I don't know. I truly don't know. But 9 months, 10 months being pregnant and like sick was absolutely miserable. I remember after I gave birth, I would wake up and I'd say every single day I'm not pregnant is the best day of my life because I had severe, awful symptoms. So basically my goal was to do as much research, was to work out, to eat healthy. None of that happened. I barely worked out. I've been lifting for over 15 years. I got into it when I was actually 15. I'm 30 now. And I've been lifting and trying to progressively overload and really build as much muscle as I can. And when I was pregnant, I could not move. It was very hard for me. I was also studying for the bar exam. So that had to be my entire life. And you feel guilty when you do anything else. When you're studying for a test of that caliber, it really takes everything out of you. So I was just trying to survive during my pregnancy. Part of me trying to survive meant that I had to get an expert, if you will. I needed a third party to come on in, and that is where the doula comes in. So doula, absolutely fabulous. So my doulas worked as a team, which was amazing because they're up all hours of the night with pregnant women. So God forbid a woman gave birth the day before me, my doula would be exhausted because she would have been in the hospital the entire night. She'd be running on 0 hours of sleep along with me. So let me just give you a couple stats about a doula. So a doula is basically someone that you hire, and depending on the state that you're in, it could be through insurance. Mine was 100% covered through insurance. Maybe there's an offset in other states. I'm not entirely sure. Definitely ask your OB/GYN. I remember my OB's office actually had doula signs up as well. So basically a doula helps you and your partner advocate for yourself, which was super important to me because I feel like an experiment every single time I'm in the hospital. It's just not for me. I don't like the jarring lights. It's very cortisol inducing, that environment, and it doesn't feel natural to me. So I really needed someone there who's witnessed so many other births and just advocating for mom and dad. So I hired a doula. They're with you every step of the way. I think once you hit like your second or third trimester, that's when the community groups start. You actually go to doula if you have a good doula. You go to classes. They teach you all about labor delivery. It was honestly one of the best experiences of my life. And I didn't even know about a doula until I was listening to a podcast of this influencer who swore by her doula. And I was like, what is this amazing avenue that we could go down? Why would we not do it? And I think it's maybe a lack of research, a lack of knowledge, which is upsetting. I hope that every female has access to doula support. So the benefits of a doula: shorter labor, less need for interventions, better pain management through techniques like breathing guidance, massages, position changes, and counter pressure. A doula really taught Michael on what to do when I was contracting heavy. And you're working a team dynamic. So it's emotional, physical, and informational support, which improves your birth outcome and makes you feel seen, heard, and cared for. So the key stats for doulas is a 39% decrease in C-sections. That's huge. 15% increase in spontaneous vaginal birth. 10% decrease in use of medications for pain relief. 38% decrease in low-minute APGAR scores, which is the baby's health measure after birth. And a 31% decrease in dissatisfaction with your overall birth experience. Obviously, I had a 10 out of 10 birth experience, but a 0 out of 10 pregnancy. So let's get into what happened during my pregnancy. I really just want to touch on one thing, which was the glucose test, my mortal enemy. So I actually am seeing a functional medicine doctor right now. I have a lot of gut inflammation. I'll touch on that later. That's part of why we wanted to start Hot for Health on the wellness side, was because I am struggling with a lot of health issues that I have been since 2017, and I'm kind of like trying to biohack my body. So the glucose test is what you take when you're pregnant to factor out if you have gestational diabetes. And they give you this god-awful liquid that is definitely red 40, definitely yellow 70. I don't know the exact terms, but it is a color that looks like candy corn, which was mine. And there's no way that those are good ingredients, because every single thing that's dyed in the United States has one of those toxic dyes in it that give you severe effects. So let me just show you guys. So this is what I found on Amazon. So don't take my word for it. I found this from a bunch of labor and delivery nurses, basically saying this was a safer alternative, because I was throwing up. I was sick for days after I took the glucose test. And I really wish my midwife at the time, because I did go with a midwife, I didn't go with an OB because I wanted more of a holistic approach. If you know anything about me, you can probably start telling and seeing that by now. It's not organic. It has the non-GMO verified on it, which does not mean that something is organic. Those are two separate labels that you should be looking out for. So this label means that something does not have genetically modified ingredients in it, but it does not mean that something is organic. I'm just here to give you the information, do whatever you want. I'm just telling you what worked for me. So that's basically pregnancy. I do have a few books. This one, Nurture. This is by Erica Chidi if I'm pronouncing it correctly. I'm sorry, Erica, if not. So this book is basically an encyclopedia, and I want to get pregnant again just to read it all over. This book walks you through every single thing, every single month. It says month 1, here's what you should start doing. Here's what you should start doing with your medical providers. It gives you constant cravings. If you're craving chocolate, what's missing? Magnesium. What you can try instead, nuts, seeds, fruits, legumes. So this is really how to live your best pregnancy for taking care of you and your baby. It's really hard to be pregnant because you do get cravings. You are sick a lot. There is a lot of constipation going on. There are a lot of symptoms that I didn't think it was going to be that bad. And then I just had a horrible pregnancy. I really did. I was so sick. I had severe migraines. The migraine medication that the midwife gave me didn't work. So I really didn't have a choice. I had to live with headache. I was also super dehydrated because I was throwing up so much that I had to go to the ER just to get IVs multiple times. It was not a fun experience, but I loved my baby and I loved my birth. So let's get to that part. So my doula gave me a TENS machine for when I started contracting. And a TENS machine is a little handheld device. You put pads on your lower back. It's kind of, I don't know if you've ever been to the chiropractor, but I'm pretty sure they have those in there. But it's basically a little device that you hold in your hand. It sends tiny electrical pulses through the skin. So the purpose of a TENS machine is it blocks your pain receptors. It basically blocks the pain signals to your brain. So these gentle pulses interfere with pain messages traveling from your uterus back to your brain. So kind of tricks your brain into thinking that you're not in that much pain. Listen, the TENS machine worked, but it was nothing like the epidural. I love a good epidural. We'll touch on that. But so my labor story is unique, and I was actually asked by my OBs and my midwife to share my experience. I think I was just so severely postpartum. I remember writing it out, and I don't even think I sent it over to them. But basically, my story is all about how to advocate for yourself, because I had a doula, I had a midwife, I kept them in the loop. I started contracting. I don't need to get into, I started feeling the pains at 11 p.m. I took a bath for hours. Like, it got down to the point, started at 11 p.m. By 8 a.m. the next morning, obviously I didn't sleep. You don't sleep when you're contracting. Everyone's like, just go to sleep. Like, do you understand that this is the worst? The pain is unbearable. And I was so afraid for the pain too. And it was just what I expected. By like the next morning, I'm now going on contractions that are 7 minutes apart, down to 5 minutes apart, down to 2 minutes apart, to 3 minutes apart. And that's the window that you're supposed to go to the hospital, because that's like go time. 2 to 3 minutes apart for, I think it's a consecutive like 10 minutes. That is a huge sign that your body's getting ready and that you're progressively dilating and everything. And you should go to the hospital, because they won't send you home at that point. It really depends. My hospital, you had to be at least 5 or 6 centimeters dilated for them to take you upstairs, because they only have a limited amount of rooms. So that's why everyone says, don't just go to the hospital when you start feeling pains. Also, like, you don't want to be in the hospital. You want to be in your own space, because the hospital I digress. I had a great experience, but like, you don't want to just chill in a hospital for 16 hours, because you're going to have to be there for the next 3 days. So I was contracting, and they actually called me a unicorn at the hospital, because everyone told me not to go, because my contractions would go down from 2 to 3 minutes. And it would be like this for like 10, 15, 20 minutes. And then on like minute 25 or minute 30, I wouldn't have a contraction again until like 7 minutes. So I did not have consistent contractions. That is what the standard, what the doulas, midwives, what they look for. So I was all over the place contracting. I was, at this point now I'm worried, because I have no consistent contractions to tell me when I'm supposed to go to the hospital. It is now 3 p.m. the next day. So the doula helps you work out like a plan with you and your partner on when the contractions start, what are you gonna do to distract your mind? What are the movements, the massages, the inversions? What are you gonna do to make sure that, actually, I'm sorry, I don't think that inversions is to flip the baby if you think that it's not positioned correctly. But there were, I forget if I was doing inversions. I was definitely bouncing on a medicine ball when I was early signs of labor and contracting. You're just in such severe pain and you kind of black out. Like I just remember leaning on every single surface in my house. Like I would go room to room and just lean on every single surface, crying with the TENS machine on the highest, trying to like overdose on the TENS machine, which is quite literally impossible, but anything to make this pain go away. Because everyone was telling me not to go to the hospital because I'm not there yet. So I was like, well, I don't think I'm ever gonna be there yet because my contractions aren't frequently staying a consistent minute away from each other, or whatever the term is. So basically, I called my mom up, and at this point, I'm in the nursery, and I'm staring at myself in the mirror, bawling my eyes out like a psychopath, and just being like, what do I friggin' do? Like, what do I do? I'm starting to get really scared because now I'm getting stressed out. Now the pain is, I don't even know if it was getting worse. It was just, I was getting to a point where I couldn't tolerate it anymore. I was going on maybe like 16, 18 hours of this pain. And it gets to a point where you just give me the medication. And so I called my mom, and my mom was like, after calling my midwife, calling my doula, they're like, you're not where you're supposed to be at contracting. Like the hospital's gonna send you home. And so I called my mom, and my mom was like, you listen to yourself, listen to your body, and you should just get the baby checked out because you are in a lot of stress right now. I also had to be watched for preeclampsia because my mom had preeclampsia really bad with me. And I started getting signs and symptoms of it. So I had to actually be on a protocol to proactively avoid getting preeclampsia. I had to take baby Motrin or baby Advil every single day, which I did not like, but I also did not want preeclampsia. So I was like, all right, screw it. I'll just go to the hospital right now. My fiance and I packed up our hospital bags, but I didn't really think that I was gonna stay there. So we didn't take the cooler that I wanted to have the placenta in. I really wanted to encapsulate my placenta. I'm pretty sure my doula did it. If not, she put me onto someone who did. I was also afraid that I was gonna give birth in the car. You like see it in horror stories. I didn't give birth until 12 hours after I went to the hospital, at least. I think it was like 10 hours after I went to the hospital. So I wasn't going to give birth in the car, even if I stayed home for another hour or two. But I was like, let me get baby checked out. They can put like a band around your belly to see the baby's heart rate. And I just wanted to make sure it wasn't elevated and she wasn't freaking out because I was freaking out. I also suffer from really bad anxiety and a lot of negative thoughts that I'll touch on later. But I was really big into affirmations this pregnancy because my mind kept spiraling. So I went to the hospital. I'll never forget the minute I walked in, a nurse looked at me and she looked at someone else and she's like, she is in labor, get the chair. So they like immediately put the wheelchair behind me, put me in a room, checked me. I was already 6 centimeters dilated. So thank God I listened to my body because that means I could get the sweet epidural. Like drug me up. I'm not doing this anymore because now it's just getting to the point where I'm so stressed out. This isn't good for me. Stress is so insanely, incredibly bad for you physically that I was like, just give me the drugs. So I got the epidural immediately. They kind of pushed it on me. I was really scared. I started bawling my eyes out because my doula wasn't there yet. She was like 40 minutes away. So she came to the hospital a little bit after me, and the nurses at the hospital were like, the anesthesiologist is really busy because I gave birth in September, which I think is one of the busiest months to give birth. But the anesthesiologist, it's now or never, basically. They were like, if you don't get the epidural in the next 5 minutes, you're not getting it for the rest of the night. And I was like, now I feel like I'm friggin' backed in a corner. I don't like feeling pressured like this. But I was like, I don't want to miss the drugs. So let me get them immediately. So I got the epidural, and they have to put this long ass needle in your back when you're in the middle of a contraction. And it was, you're just like, imagine being in the worst pain in your entire life and like you're shaking because you're in pain. But if you move when the epidural is getting, like, I think you could be paralyzed. You cannot move when they're putting the epidural in your spine, because if they put it in the wrong part of your spine. So I remember, I think I still had the TENS machine on my back, and I'm like, I have it up to the highest level. My fiance's holding my hand, and they just put the epidural in, and within a matter of minutes, I think it was seconds or minutes, I was chilling. And then my labor and delivery room was literally a nightclub. So what I did was I was very, very intentional with the space I wanted. So I shut off all of the cortisol-inducing lights, low lights only. I brought my own flickering candles. I brought my own everything for the baby. I didn't want my baby touching the hospital blanket, but I remember at one point they did wrap her in the hospital blanket, and I feel like that's where she got eczema from. But so I had the Amazon like flickering little candles. I had affirmations. So like I said, I suffer from really bad anxiety, and even though the epidural, I wasn't really doing that much of pushing through the pain, like you're not in pain anymore when you have the epidural, I still wanted my mind to be right. So I printed up affirmations and I put them in like 72-inch font, and I brought tape and I hung them all across my labor and delivery room. So low lights, I put on music that I liked. My daughter actually came out to the Lil Wayne song She Will, which is just like, she's so chill. So we had a whole entire playlist going of just songs that I really liked. We had like birthday party songs in there. She came out to the song she wanted to. That's so on brand with her. And then I had these affirmations. So a few affirmations. I'm working together with my baby. Birth is a natural, safe process. My baby knows how to be born, and I know how to birth. I am powerful. I am resilient. I am calm. I ride each wave and let it pass. My body was made to do this. Each contraction brings my baby closer to me. I trust my body and my baby. I am safe. I am supported. I am strong. So I had these all over the labor and delivery room. I was afraid for two things. I was afraid for the umbilical, just like my entire pregnancy. I would just like sit and like let the shit really get to me. So let me start with this. I was afraid the umbilical cord was going to be wrapped around her neck and she was going to die. And I was afraid that I was going to be paralyzed from the epidural. I always knew I wanted the epidural, and I was afraid of paralysis, that I was going to be in a wheelchair. So of course, when she came out, the umbilical cord was wrapped around her neck. I'll never forget hearing, you're so sedated. The epidural is actually fentanyl. It has fentanyl in it. That's how it like drugs you so severely, and that's why you're pain-free. I don't know what the other active ingredients in it are. I'll never forget the midwife was like, oh shit, the umbilical cord's wrapped around her neck. I didn't catch this. Like normally I think you could catch it with imaging, or you could just see by the baby's heart rate if something is interfering with her like steady heartbeat. My baby was fine, thank God. She didn't have like a bruise or anything. But so my entire pregnancy, I was afraid for that. And of course it happened. Another example of how your thoughts create your reality. I don't know if any of you have watched The Secret or read the books or are into like Joe Dispenza or manifesting, but you truly create your life with what you think and what you believe. And it's just so important to get into a good headspace when you're bringing a baby into this world, and even postpartum, because it's so hard, but it is doable. I mean, I still want another baby. So it's not like it's so hard where you're like, never again, like give me more. And then my other fear was that I was going to be paralyzed from the epidural. And so after I gave birth, the anesthesiologist was nowhere to be found. He was probably helping a bunch of other women, but the epidural was pumping fentanyl into my back for an hour after I gave birth. It got to the point where I started screaming. I was like, if you do not shut it off, and I guess the nurses can't touch it, like their protocol, they cannot touch the machine that's pumping it into my spinal cord. And I was like, I'm gonna rip this machine out, get it out of me right now, because I could not move and I wanted to be able to walk. I wanted to be able to stand up. So I couldn't walk for half a day. One of my legs was completely paralyzed. My right leg, I could not walk. I had to go on a stroller basically it's like a wheelchair that you put your knees on, and there's like a chest pad, and you like kind of like lean forward. So I was afraid that I was going to be paralyzed, and luckily it wasn't a long-term thing, but I did lose sensation for half a day. Okay, I do want to say a little bit about how I gave birth, because I absolutely killed it. So I only pushed for 38 minutes. It definitely wasn't 28. It must have been 38 minutes. I am bad with memory unless I write it down. So ladies, I just want to say there's a bowling ball in your butt and push it out. That is exactly the sensation, how it feels. So apparently there was a woman who was giving birth before me. She pushed for 7 hours because I don't know if she was afraid to like make a bowel movement, or she didn't know the sensation on how to push, because it is, I mean, it's something that you really have never experienced before, but I pushed my baby out in 38 minutes. So don't be afraid to do what is absolutely necessary. So after I gave birth, I immediately thinking like, I am the most powerful woman in the world. I just literally gave life. I just pushed a baby out of me, and now my newborn baby is laying on my chest. It's the most wild feeling. I bet it's even more of an incredible experience if you're not drugged up on fentanyl. But I just couldn't go through with that pain. But they do say if you have a natural labor, no drugs, no interventions, you do feel it's like a wild connection to your baby, but that doesn't mean that you don't feel a connection to your baby if you do use interventions. Either way, it's your baby that you're meeting for the first time. So there's a lot of things that I wanted in my birth plan. So my doula helped make a birth plan. So a lot of the birth plan was delayed cord clamping. You don't want the shots immediately. So when I say delayed cord clamping, I mean the umbilical cord is completely white and the blood is removed completely before they clamp it. There's a lot of things that I don't really want to get into the nitty gritty because I will sound like a psychopath to some people. You know what? Let me bring up my birth plan. So my birth plan was I preferred to keep moving as much as possible, walking, massages, Pilates ball, hip squeezes, acupressure. Once you get the epidural, they don't let you walk because you're obviously paralyzed. No eye ointment, I'll sign the refusal form. The vitamin K shot and the Hep B vaccine delayed until a latch has occurred. Things I would have done differently, no shots. Like, why does my baby need a shot for STDs if I don't have an STD? It's just wild how the minute the baby comes out, they automatically already want to jab the baby. There comes a point where you are so drugged up, you're so tired because you're quite literally in labor, but like your labor is not like 3 hours. So you're exhausted. I normally go into labor starting at the end of the night because that's when your body is the most relaxed too. Like you don't just like wake up and start contracting. I'm sure some women do, but statistically you go into labor when your body is at night, when you're relaxed, and that's when baby's like, I want to come out, mommy. So it's really hard to advocate for yourself when you're extremely tired, when you have 7 people crowding you, basically being like, you need to do this because this is a protocol. Like they really do make you feel like you're doing something wrong if you don't want one of the procedures that they do at the hospital. I remember them forcing the baby on me to latch with breastfeeding, and my baby was just tearing me apart. Like she did not know how to latch. And it got to the point where I couldn't even breastfeed because this one nurse I wasn't even upstairs yet to be with like the experts, with the breastfeeding experts, the lactation experts, what they called it. I wasn't even with an expert yet. And this one nurse came over and was having the baby latch incorrectly. I was like, what are you doing? You're ruining this experience for me. So like, do what makes you feel empowered and what feels right to you, because they have a protocol that they need to do. Insurance pays, whatever. This is your life and your experience and your baby. Don't let anyone else rob you of the fact that if you come in with a set of things that you want to do, don't let them peer pressure you out of it. Like if you don't want to breastfeed immediately, they're going to make you feel like you're an awful mom. I see it a lot. I hear it a lot, and I experienced it myself. Like I'm literally bleeding, and they're basically saying that if I don't do this, my baby is not going to grow up with the nutrients that it needs. Like, just relax, okay? Just settle it down. Go help someone else. Let me live my experience. Let me live my life. So basically, after that, once I got up into I forget what they call it, but I left the hospital after 2 days. They tell you to stay 3 days, probably because insurance wants the money, because we live in the United States and it's all about the profits, all about the money here in the healthcare system. That's what's literally coming out right now, what we're finding. I left within 2 days and they tried to tell me no, and were you gonna false imprison me? I'm literally leaving. You cannot hold me here against my will. Baby's okay, you're coming in every 2 minutes. You're trying to wash my baby with shit soap. It was like, oh God, it was so toxic. And I was just so tired and so scared that I let them do it. But like, I'm gonna be in such a better headspace with like, I will start meditating, I will start praying more. I'm gonna be in such a better headspace that when these nurses try and bring my baby around their toxic blankets that they wash in Tide detergent with their disgusting dish soap, it infuriates me thinking back on it and how I let this happen when I told myself I wouldn't. I was so tired and I was just getting so much pushback from them. Some nurses understood, like when I told one of the nurses I wanted to leave, she was so sweet. She packed 2 trash bags full of the cold, like almost diaper things, because you are, with a vaginal birth, you are so sore that you are just diapered up with you get like the spray, you get the cooling pad, and you put it in your disposable underwear and they make it like a little cocktail for you. It's absolutely amazing. She packed up 2 trash bags full of all the goodies. And I didn't care about organic ingredients with that. Like, I'm bleeding everywhere. I'm in so much pain. Please give me whatever you have. I will take the lot. So that's basically that. I left the hospital. I think I had to sign something saying I understand what's going on and I'm out of this bee. Like, I'm not staying here. And then postpartum was a wild, awful ride that I am now just feeling like myself again after 2 years. So we'll have another segment on postpartum. Actually, one more thing that I did want to share is this book that helped me so much. So what I did to cut my labor in half, I had 6 dates a day starting when I was like 34, 35 weeks pregnant. I had 6 organic dates a day. And there's actually a medical journal that I read that it makes you be able to push out your baby quicker. Now, I don't know if that's what helped me, but so I had 6 dates a day. It was absolutely disgusting. I was choking them down. I had to get the ones covered in coconut shavings. I had to throw them in smoothies. I did what I had to do because I'm a research girly and I saw the stats and that helped me a lot. This book also helped me a lot. Cut Your Labor in Half, 19 Secrets to a Faster and Easier Birth. I literally have tabs. Michael was supposed to read. I don't know if he ever read this. I think he did because I was a nutcase. This was for my fiance to read. Fear Equals Pain. Oh, another one for Michael. Know when it is really time to go to the hospital. Like, I have this tabbed out and also has practice. So hold ice cubes for minutes at a time. You can at least like start prepping yourself for just like breathing through it. So I really hope that you guys enjoyed this. I hope that you got a lot of information, especially from the insight with the doula. Definitely look into that. It may be covered completely in your state. One of the best experiences I ever had was having someone fight for me and just teach me all about it, because I didn't go into this blind. I really was aware of every single thing. It's just a matter of not following it. But at least I was informed on every single thing that was going on, every single ingredient, every single vaccine. I knew what was going on, and it wasn't just something that was so overbearing and jarring to me. So I hope that you guys like this. Thank you so much for listening and tuning in, and we will share the next episode in the series for postpartum, but I believe that Abby is up next to film hers. Thank you, guys.